Om Dham Dhanvantare Namaha. A very good morning to one and all. Welcome back to the second day of Sushrutha Avabodhini 2.0, a national conference on revolutionizing degenerative disorder care, intersection of Ayurveda, innovation and technology, organized by Sushrutha Ayurvedic Medical College and Hospital in association with SVR Sadin University and Vishwa Ayurveda Parishad, Bengaluru, Karnataka.
In the hall, we are privileged to have Dr. Shailaja, Principal SDMCA and H. Hassan, Dr. Madhav Diggavi, Professor, Department of Kaya Chikitsa, Taranath Government Ayurvedic Medical College, Dr. Veeraya Hirimat, Dean PG Studies, Gavisiddeshwara College, Koppal, Dr. Giridhar Vedantam from Gorakhpur College, and also Yogacharini Dr. Sumana Potugunta, Principal of Sri Vishweshwara Yoga Research Institute, Tirupati. A special welcome to you all.
Let's begin today's event by invoking the blessings of Almighty.
Namami Dhanvantarim Adidevam Surasurairvandita Padapadmam Loke Jararudbhaya Mrityunasham Dataramisham Vividhaushadinam Om Shanti Shanti Shanti.
We have had the privilege of hearing from esteemed speakers yesterday who have enriched our understanding with much and left us with much to ponder. And we are thrilled to continue this incredible journey of knowledge and inspiration. Today's session it is a very promising session and it will have an impact just as yesterday's. We would like to welcome our speaker, Dr. Sathyaprabha T N ma'am, and today's chairpersons, Dr. Prasanna M. Rao sir and Dr. Ramesh Kumar sir onto the stage.
To begin, I would like to introduce our distinguished speaker, Dr. Sathyaprabha T N, Professor, Department of Neurophysiology, Mimans. Ma'am has completed her undergraduation from Kempegowda Medical College, Bengaluru, post-graduation in the Department of Physiology, Bengaluru Medical College, PhD from Maastricht University, Netherlands, and DSc from SVR University, Bengaluru. Madam's major scientific fields of interest lies in autonomic dysfunction and pulmonary dysfunction in neuropsychiatric disorders, neurobiology of yoga, animal models of ALS. Ma'am has published more than 150 articles in international and national journals in English journals and reviewer of many national and international journals. Ma'am has various honors to her credit: Academic Council member of Aditya University, the executive member of Indian Epilepsy Association Bangalore branch, Chairperson, Ethics Committee, Scientific Advisory Committee, Zindal Institute of Nature Care, Visiting Professor SVR Sadin University, Bangalore, former Chairperson, HOD Neurophysiology, Mimans. Ma'am has been awarded with Professor Baldev Singh Oration Award, Dr. Kalpana Chawla Award for Young Human Scientist Award, Professor S.B. Deshpande Award for the Best Research Work in Neurophysiology, and the list goes on, ma'am. Currently, ma'am is working on ongoing project ICMR 4.3C.
We would like to welcome ma'am to this session. I would request Dr. Soumya ma'am to welcome our speaker with a floral greeting. This session will be chaired by two eminent personalities, Dr. Prasanna N. Rao sir and Dr. Ramesh Kumar KL. Let me introduce our first chairperson, Dr. Prasanna Narasimha Rao, BAMS, MD, PhD, Diploma Yoga. He is Professor Emeritus, RGUHS University, Karnataka, Bangalore, and he is the Director of SDM Ayurveda Institutions, Educational Society, Ujjain. Sir has a very distinguished career and he has been constantly involved in bettering the healthcare and the society. In the 27 years in which he was the head of the Institute of SDMCA and H. Hassan, Sir has made the institute par excellence in Ayurveda education and healthcare. Sir has also developed various MOUs with international universities, industries of national repute, NGOs, etc. As the Dean of Faculty ISM in RGUHS, Sir has brought in the doctoral programs for ISM. He is a part of advisory boards in many universities, and that has led to the enhancement of quality of education in Ayurveda healthcare. Being the executive member of CCIM, the apex body, Sir was instrumental in introducing the MSR for ISM colleges and hospitals, and being the member secretary of the committee constituted by Ministry of Ayush GOI, Sir was instrumental in implementing the recommendations of the task force IMCC Act 1970, which has led to the present day development like developing the national important institutes in Ayurveda, NEAT, AIAPG80 and the exist test for Ayush. Sir is also inducted into the apex body by the Government of India Ministry of Ayush, CCRAS, and he is also the chairman of Ethical Committee of Government Medical College HIMS. Sir's expertise lies in the Sarasutra department. He has professionally taught and trained thousands of Ayurvedic clinicians, specialists and super specialists over the last 31 years. We welcome you, sir. I would request Dr. V.V. Reddy, sir, to welcome sir with a floral greeting.
It's my privilege to welcome Dr. Ramesh Kumar KL, Sir, Associate Professor, All India Institute of Ayurveda, New Delhi. Sir pursued PhD from IPGT and RA Gujarat Ayurveda University, Jamnagar in the year of 2016. Sir has presented many national and international scientific papers, and Sir contributed as co-investigator in Namaste portal, a standard Ayurveda terminology portal run by National Institute of Indian Medical Heritage, Hyderabad. Sir, currently working on the project mapping of Ayurveda climatic regions. We welcome you, sir. I request Dr. Alok sir, Principal SAMC, to welcome sir with a floral greeting.
Without further ado, I now request our speaker, Dr. Sathyaprabha T N ma'am, to take over the session and deliver her speech.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. At the outset, I would like to thank Ramakrishna ji and the organization for inviting me for this conference. Today I'll be talking on application of cardiac autonomic function test in neuropsychiatric disorder in Ayurveda research. So let us start our talk with salutation to Dhanvantri. So in my talk, I'll be talking on introduction to autonomic nervous system and how do we evaluate autonomic nervous system and what the relationship between Ayurveda and autonomic nervous system and what we have done at NIMHANS Ayurveda research, few research we have done, integrating AFT and Ayurvedic research. My voice is wavy, is it? Because I'm turning that side. I can have a mic, otherwise I can hold in mic and talk. And the conclusion. Yesterday I was discussing with Dr. Shivram who came here for the talk. He said majority of the students are there. So I'm going to talk very basic of autonomic function so that you can use in your research. When you become a PG, you can use that as a part of your investigation in your research. So I've added more slide compared to what I prepared earlier. Then he said there are many students and upcoming scientists are there. So I thought it's my duty to include the basic slides. So what is autonomic nervous system? The moment you hear the autonomic nervous system, what will come to your mind? Autonomic means it is automated. So autonomic nervous system, it will balance all the internal organs, internal function. So mainly maintaining the blood pressure, heart rate, thermal regulation, respiration, gastrointestinal, bladder, sexual function. See, many of the things will not be knowing. See, now I'm standing and talking. My heart rate is different from your heart rate because you are sitting and listening. So the moment I got up, I started talking, automatically my heart rate changed. So I didn't say, oh, I'm getting up, you need to pump more. No, this is all automated. So that is done by autonomic nervous system. And how do you evaluate autonomic nervous system? These autonomic function tests are non-invasive. We don't draw the blood, we don't inject anything. So it is by heart rate and the blood pressure. And of course other pseudomotor tests are there, I'll be explaining in future slides. So we are going to record autonomic function test. So you have cardiovascular autonomic function test and pseudomotor autonomic function test. Pseudomotor is mainly by QSAT and TST. It's not working. It's not working. Okay. Okay. So in this slide, you can make out autonomic nervous system. First is nervous system divided into central nervous system and peripheral nervous system. And in that, somatic nervous system and autonomic nervous system. Autonomic nervous system in turn divided into sympathetic system and parasympathetic system. Today we'll discuss about the autonomic nervous system, which includes sympathetic and the parasympathetic. And sympathetic system, it arises or it becomes to action whenever there is a stress. Even sitting to standing is a stress for the body. Laying down to standing is also stress for the body. Whenever there is a stress, that will come into action and it will maintain the homeostasis. Whereas parasympathetic is, it controls the body when you are rest. So usually in people practices yoga, they have more of parasympathetic activity compared to the sympathetic activity. Okay. So what is this autonomic nervous system? It is an ultimate survival machine. That is, at the time of death, this will dearrange. So when you have a very good functioning autonomic nervous system, that means you are alive and best. And the most striking feature of this autonomic nervous system is the rapidity and the intensity with which the visual function tell. That's what I told you in the last slide. The moment I stand up, heart rate increases, blood pressure increases. So it won't wait with the cerebral cortex to give the instructions. So the rapidity and the intensity. From sitting, I got up, the about 30-degree changes, so accordingly blood pressure, heart rate changes. If I'm laying down to standing, again that will be different. So this is very important, rapidity and the intensity. And in here you can see, it's not very clear, okay. Autonomic nervous system has got supply from eye to the rectum. All the internal organs are supplied with the autonomic nervous system. The first autonomic nervous system lab was opened or started functioning in Queensway Hospital, London in 1975. Before that, they were not specified lab, and it was my fortunate to have my fellowship, 6 months fellowship, under the great pioneers of autonomic system, that is Professor Christopher Matas. I had my fellowship there. Okay. There are a number of definitions. What is autonomic nervous system? It's also called as an involuntary visceral vegetative nervous system, because even in the person who is on the bed rest or vegetative, that means his wholly heart and the lungs are functioning, brain is not functioning, even then this is working. It's also called the vegetative system. And autonomic nervous system is a critical component of the central and the peripheral. Main aim of autonomic nervous system is to maintain the homeostasis. And it regulates arterial blood pressure and respiration, thermoregulation, sweating, motility, maturation and the sexual function. See, I would like to say we had a court case from High Court. We get to do this one test. Why I telling this is sexual function. So in that, we get a reference, first letter came saying that one Mr. Rao, some ex-Rao, you have to do this autonomic nervous system and say whether he can have a sexual function or not. And the thing was, he tried to modulate some with a servant lady. Then the letter came to me, MS gave it to me, and then I gave it to my doctors. And in that one girl, he said, "Madam, let him come." I said, "What do you think of servants or ladies? He is such an elderly man, 72 years, and he has done this." So she was so angry. Okay, let him come, we'll do the test. So when he came, a senior cultured family, husband, wife and son has come. We were shocked to see that those people had got allegation. It was very, very surprising. And he's a diabetic and we did the test. According to a test, it was not positive. So here the lady has taken the advantage. So simply she has put a file case on that. So my junior doctor said, Madam, what the wrong thing, seeing the report. That's what they say, in Kannada, ನೋಡಿದ್ದು ಸುಳ್ಳಾಗಬಹುದು, ಕೇಳಿದ್ದು ಸುಳ್ಳಾಗಬಹುದು, ನಿಧಾನವಾಗಿ ಯೋಚಿಸಿದಾಗ ನಿಜ ತಿಳಿಯುವುದು. That means whatever you hear, whatever you listen may be wrong unless you see. So even with you students, you say, my friend said something, my teacher said, don't worry, you think and see whether it is true or not. So then only you can realize. So this function, we get it from the court case also to do this test. And coming to anatomy of the autonomic nervous system, whereon it is situated, it is central autonomic network, and it's also known as a central autonomic network, which includes insula, medial prefrontal cortex, hypothalamus, amygdala, ventrolateral medulla, nucleus tractus, solitarius. These are the one which influences the autonomic nervous system. In that, hypothalamus is the seat of autonomic nervous system. All are important, but hypothalamus is the seat of autonomic function. And coming to the peripheral autonomic nervous system, you have a sympathetic and parasympathetic system. And parasympathetic system, as I mentioned earlier, it is always in the rest and digest, whereas sympathetic system, fight and flight. So in these regions, situations, the sympathetic will arise. Coming to in detail structure of sympathetic system, the origin is thoracolumbar. That means the 5 starts from thorax, that is T1 to L2, and it is thoracolumbar, T1 to L2, the fiber starts. Pointer is not working actually. Okay, the fiber starts from T1 to L2, comes out, and then it forms a paravertebral ganglia or sympathetic chain. Very next to the vertebral column, ganglia is called as a paravertebral ganglia, sympathetic chain. From there, postganglionic fibers will start. Can you see in this diagram? From T1 to L2, there is a thick line. After that is a dotted line. Why is the difference? The postganglionic fibers are unmyelinated or lightly myelinated. Preganglionic fibers are myelinated. That's the reason you get. And see here, even sympathetic system, for eye to rectum, uterus, intestine, all the intestinal organs, it is supplied by the sympathetic system. And as I mentioned, this sympathetic with the short, lightly myelinated preganglionic fibers and long postganglionic fibers, and ganglia situated very next to the spinal cord, hence it is called as a paravertebral ganglion. Okay, because it is from T1 to L2, how does it supply brain? Isn't it? How does it supply the leg? This is the distribution. T1 supplies the head, T2 to neck, T3 to T6 thorax, T7 to 11 abdomen, T12 to L2 the legs. The reason is whenever there is a spinal cord injury, either it can be accident or a tumor or a compression injury, these particular places you find dysfunction of the sympathetic system. So what are the functions of sympathetic system I mentioned? It is stimulated in the E situation. E means emergency, embarrassment, excitement and exercise. These are the situations sympathetic system is stimulated. And how do you know it is stimulated? You can see dilation of the pupil, increase in the heart rate, force of contraction, decrease in the blood flow, increase in the blood flow to the skeletal system. If I see a snake, I'll try to run away. So when I'm running away, I need more blood supply for the skeletal system than the intestine. So increase in the blood flow to the skeletal system and decrease in the non-essential. So when I see a tiger or lion, I need to run. My GI system is non-essential. Similarly, after the foot, my calf muscles are non-essential, the intestinal organs are essential. So there the blood supply will increase. Depending upon the situation of the body, the blood supply will be regulated. And and also glucose level increases. It is called as a gluconeogenesis. Apart from carbohydrate, sugar, the glucose will be formed in the body during the sympathetic stimulation. Coming to parasympathetic, it is craniosacral, that is from the cranium to the sacral, nothing in lumbar or in the thoracic. So you have fibers emerging from cranial number 3, 7, 9 and 10 and sacral S2 to S4. Again here you can see all are dark lines, that means there are preganglionic fibers, whereas in sympathetic the paravertebral ganglion was there, then postganglionic fibers started. Whereas, that is in the sympathetic. In parasympathetic, that goes very next to the adjacent target organ, it forms a ganglion and it goes. So, postganglionic fibers are short, preganglionic fibers are long in parasympathetic. See, that's what I said, preganglionic are long, postganglionic fibers are short. So you can see this is the neuron and this is the preganglionic myelinated and then ganglion, postganglionic fibers are unmyelinated. So function is rest and digest mechanism that conserves the body energy and normally dominated over the sympathetic system. In 24 hours, majority you find the parasympathetic compared to the sympathetic, and this is called as the slug type response. So that is salivation, lacrimation, urination, digestion, defecation. Always there is a decrease in the heart rate, decrease in the diameter of the airways and decrease in the pupillary size. So now we know anatomy is over, we know where are the central part, what is the peripheral part, two different types. What is next? How the impulse is transmitted? It is the neurotransmitters. So the neurotransmitter in somatic fibers, it is only acetylcholine. There is a pudendal nerve, popliteal nerve, radial nerve, ulnar nerve. Their information comes. There is no ganglia here. That is the difference between somatic and the autonomic functions. So it's always, there is no ganglia, so there is only AC, that is acetylcholine is the neurotransmitter. Whereas in autonomic nervous system, sympathetic or parasympathetic, it is acetylcholine. Whereas postganglionic fibers, depending upon the target organ, it varies. That is, parasympathetic is again acetylcholine, whereas sympathetic for the blood vessels is epinephrine, norepinephrine, sweat gland is acetylcholine, and to the heart muscle and the glands are norepinephrine. So this is the synaptic connectivity I have already mentioned, and this is the summary what all I told now. So it has got two usual sympathetic system, T1 to L2, and ganglia is near to the spinal cord, and they have a short postganglionic fibers and the long preganglionic fibers, mainly fight and the flight. Coming to parasympathetic division, preganglionic neurons of the brain, and hence you have a preganglionic fibers are long compared to the postganglionic, and the target organs are there, and then main function is rest and digest. So with that, we know what is anatomy and neurotransmitter. Next we'll see how do we evaluate autonomic function test. So to determine whether autonomic function is normal or abnormal, if abnormal, to assess with sympathetic, parasympathetic, and also the severity of the lesion we need to say. One important thing you should see is, because autonomic function is a multiple, you saw no, from eye to the rectum, which one to test. And another point you should remember is, these are postganglionic fibers are unmyelinated. Hence, conventional nerve conduction study cannot be done. What we do, like how you do the, if you want to see the sural nerve or ulnar nerve, you can do the nerve conduction study. Autonomic nervous system is also a nervous system. Why you cannot do it? Because postganglionic fibers are unmyelinated. Conventionally you cannot do. Of course you can do, it's very tedious. You have to put needle and then do it. What are the key features? The patient may have orthostatic intolerance, skin changes, genitourinary changes, gastrointestinal changes, they can complain. And why do we do this autonomic system? One is for the diagnostic, that is suspected generalized autonomic failure, dysfunctional is the small fiber neuropathy, and diagnosis of the POTS. POTS is nothing but postural orthostatic tachycardia. That means you record blood pressure and the heart rate when you are laying down, and then ask the subject to stand. The moment they stand, if the heart rate comes down, goes more than 30, suppose my basal is 80, when I stand up, if my heart rate goes more than 110, it is called as a orthostatic tachycardia. One point you should remember, BP should not fall. If I am standing, if the BP from 130 to 90, if it falls, that is automatic. To come back, heart will pump more. When there is no BP change, only heart rate increases. That is called as a POTS. That is very, very common in young adults, maybe 20 to 30 years, and they have a symptoms, palpitation, they feel like tiredness. So in implants, the patient will go for a psychiatry, then neurology. Then when they come for this, we'll identify what is POTS. And to prognostic, to monitor the course of dysautonomia, and in the research to evaluate autonomic involvement peripheral neuropathies. Nowadays, it is so much used in alternative medicine. So that is effect of yoga and Ayurveda, because the people don't buy if it works. We have to prove with this saying that yes, it improves. So these are the tests done to support our theory. So how do we do pseudomotor, adrenergic and cardiovagal tests? I will be telling you. So the convention test is called as a Ewing's protocol. These are the tests. I am not going to the detail. If somebody is interested, you can contact me, you can come to our lab. I am sure you also have autonomic lab here. About few years back, about 10 years back I think, I came here when they are setting up the lab. So you can do the blood pressure variability and imaging study also you can do with the autonomic function test. And here before you record, you should know the important adequate review of the patient medication. Suppose I am a hypertensive, already I am taking beta blocker, my sympathetic activity will be low. So you should know the history of what the patient is taking, and concurrent illness, diabetes will have autonomic neuropathy. So you should know all the things and then do the investigation. So what is the prerequisite? Patient should not have food, coffee at least 3 hours before the study. A patient comes to you with a cigarette and a coffee just half an hour before, that will stimulate the sympathetic activity. You will not be recording the correct, it will be a false positive recording will be there. No acute illness, these are the lab standards. And autonomic function test should be extension of the clinical autonomic history. So you should ask what is the history, then you should do the test. And what are the important thing? Heart rate variability. It is the heart rate is not constant. Even you can measure yourself. Now it will be 78, 80, 82, it keeps varying. And analysis of beat to beat is very, very important, and the aim is to maintain the homeostasis. Well, how it is different from heart rate? So clinician, no, you measure the heart rate. Normal heart rate is 80. Suppose when I record one more subject, if it is 110, I say it is tachycardia, right? What is the cause of tachycardia? You will not be knowing in the clinic, just measuring. So it can be two reasons. One is sympathetic stimulation or parasympathetic withdrawal. So parasympathetic is a vagus nerve which supplies the heart. This will have controlling effect in the sense the normal, what is the normal heart rate or a heartbeat? Suppose if I take my heart and keep it in a bowl with all the sodium, potassium, sugar, everything, how much it will beat? In the chest it will be 80. When I keep it outside, it may be around 140, 150, depends upon the individual. Why is this? Because vagus is inner, we are taken off the vagus because we are kept it outside. So when I put back into my heart, it is vagal inhibition is there. So the heart rate comes down. So when there is 80 to 110, there are two reasons. One is sympathetic stimulation or parasympathetic withdrawal. So for that you should do the heart rate variability is a test. Then you can know whether sympathetic is balanced or parasympathetic is disturbed. For that heart rate variability is very, very important. And this is how we do. I will not go into the detail. See, depending upon the RR interval, if the RR interval is 8, 5, 9 seconds, then heart rate is 70. If the RR interval is lesser, heart rate is more. So it's indirectly depends upon the heart rate variability, that is RR interval distance and the numbers. So we have time domain and the frequency domain. I will not go into the detail. This is all fast Fourier transformation. This software will do. And always you should express heart rate variability in a normalized unit. What is normalized unit? If I say a person weight is, one is 80 kilo, one is 60 kilo. You usually say 80 kilo person is fatter. That is what we say. But we should see their height also. If the 80 kilo person is 6.2 and another 60 kilo is only 4.10, who is fatter? 60 kilo is a fatter. So always you should express in a BMI to know the structure of a person. Similarly, you have to see the formula and then comment on this is called as a normalized unit. So this is the important of what is RMSAT. If this is a difference in RMSAT, it maintains the high frequency. So each parameter will tell us where is the dysfunction. And this is the frequency domain, this is the frequency domain, that was the time domain. So each one will tell where is the problem, then we can bring to a conclusion. And this is the normative data. Always you should have our own normative data so that it will be easy for us. Coming to test, so these are the 5 tests. Valsalva maneuver, isometric hand grip, orthostatic and the tilt table. These are the 5 tests for Ewing's protocol. I will not go into the detail. What happened? I think you should change the battery. Okay, it's going now. See na, do it now. So this is the deep breathing test. We ask the subject to breathe only 6 times a minute. Next slide. Next slide. Yeah, Valsalva is also, this is a test performed to see the integrity of the baroreceptor reflex. Next slide. And this is how it looks. See, the first one is the blood pressure, the ground, second, the bottom one is the heart rate. You can see that there are 4 phases of Valsalva maneuver. Each phase is how it can be seen. This is how it looks. Next slide. And the first one is the control, healthy volunteer, and pure autonomic failure. This is how the Valsalva maneuver looks. And MSA with orthostatic, that's how it looks. And PD, that is Parkinson's disease, orthostatic, this is how it looks. This is a typical different Valsalva maneuver. Next slide. So the main significance is the ratio reflects the entire baroreceptor reflex and sympathetic efferent to the blood vessels. Next slide. So this is again hand grip dynamometer, mainly for the sympathetic system. Next slide. This is also orthostatic. So here there are 2. Anything with heart rate changes reflects the parasympathetic. Anything with changes with the blood pressure reflects the sympathetic. Next slide. Next slide. Okay, so we do the change of posture. One is the standing, active standing, and the tilt table. So when you do it in a tilt table, the gravity is taken off. You get actually the change in the posture. Always is better to do the tilt table. If you don't have a tilt table, you ask them to change the posture. Next slide. Yeah, another test is called as a cold pressure test. It is mainly for sympathetic system. We ask the subject to immerse the hand in the cold water between 4 to 6 degrees centigrade. If we take a lesser one, it causes a pain. Cold water also causes a pain, and pain will stimulate the sympathetic system. Okay, how do we grade autonomic function? These are the 5 tests. We're going to grade this, and this is the normative data from our own lab. And the grading has to do early involvement. If one heart rate or one blood pressure is more, then you go to the early, definite, and the severe. This we published first time in 2008. This one, and most of the people are following this now. And coming to pseudomotor, now all this while I was talking about cardiovascular. Pseudomotor is for the, how much time I have time, sir? No, I thought, should I skip and go for 15 minutes? Okay, yeah. So pseudomotor function test, because we know that sympathetic system supplies the sweat gland, hence we should know the autonomic function. What are the different methods? One is the pseudomotor, that is central regulation, thermoregulatory sweat test, and galvanic skin response, Q-SART, and sympathetic skin response. All the things we do at NIMHANS. So the anatomy of the functional pseudomotor function is preganglionic is hypothalamus. I told you hypothalamus is the seat of autonomic nervous system. The fiber starts from hypothalamus. Postganglionic is from the C fibers, and effectors are in the sweat glands. So what we do at India, they don't do this, and I learned when I had my fellowship at London, what they do is, the patient is painted with one color, either it can be iodine or different colors, whatever available, and they're with the minimal clothing, they are going to made on the table with the infrared rays. Basal oral temperature and the rectal temperature will be taken, and the room will be heated. The heating should not exceed more than 70 minutes to avoid the decline in the total sweat production, and usually by 30th mean the sweating is achieved, and the temperature should not rise more than 1.2, either oral or rectal temperature should not increase. This is how they look. Infrared cameras are there, heating will be there, with a minimal temperature oral and the rectal will be given, and we record the temperature. So the common indicator are alizarin, red powder, iodine, it depends upon what is available. So when we paint the body and keep it there, after sweating the color changes. If there is no sweating, the color will remain same. I will show you the picture how it looks. This is the one. So as you increase the temperature, skin temperature, oral temperature, sweat production, everything automatically, this is grafted. They will be taking the different levels of measurements. Next slide. Yeah, next. So we are going to see how much sweat production calculated by 100 to give the percentage of thermal regulation. This is how it looks. Normally, when you paint the body, sweat production is there. So we don't paint the head and neck. So that's how normally. Whereas in diabetic neuropathy, it is called as a glove and stockings. It's famously called. That means peripheral neuropathy. There is no sweating will be there. And here T1, T10, so that particular part, and T9 where it supplies the lower limb. And the E is completely pure autonomic failure. Even after the increase in the temperature, there is no production of sweat. And this is in the different diseases: leprosy neuropathy, AIDS myopathy, diabetic neuropathy, small fiber neuropathy, Horn syndrome. And T2, I told you, it supply head and neck and upper limb. Whenever there is a transaction of the T2, you don't find any change in the color. That means there is no sweating at all. Next slide. So another test is called as a Q-SART test. We'll go faster. Next slide. I will not go to do. Next slide. So this is the machine. This is around 30 lakhs. Fortunately, we have at NIMHANS, because NIMHANS we require the pseudomotor function also, the different diseases, and Next slide. This is the procedure. Next slide. You can go ahead. This is the 4 points we do it. Next slide. This is how we put the electrodes and we measure. Next slide. Next. So what we do is we record the basal recording, and then we in the slide, in the electrodes, we inject 1 gram of acetylcholine in 10 ml of water, that is 0.1% of acetylcholine. That will stimulate the sweat production. So we'll have the basal recording and stimulation with the acetylcholine. Next slide. So this is in the different 4 limbs how it comes. We have the stimulation and then latent period, then you can see the graph is going, and after some time it comes back. So this is the normal recording in all the 4 limbs. Next slide. So as I mentioned, there are 2 types of sweat response. One is the spontaneous or resting, another one is the evoked. You are going to inject or locally, not intravenously, put the local acetylcholine, then you stimulate the sweating. Next slide. Next slide. So we look into the next latency and the production. At what time it start production? That is the latency. How much it is produced. Next slide. Next slide. Yeah, that's what I said. Latency and duration configuration. Either you can have, normally you should have 1 to 2 minutes latency. Duration less than 5 minutes, it should come down. And configuration, rapid rise and the slow fall. And it is abnormal in the reduced, it can be reduced, absent, excessive. Next slide. So this is the normal, middle one is absent, reduced, and the hung response. Depending upon the diseases, we can get this type of a response. Next slide. So next slide. So this is the basal recording, stimulation. Next slide. So here the pitfall is incomplete removal of the oil will not give the correct. So what we do, you have to clear the area with a mild spirit so that there is no oil in the body, so that it won't give the erroneous value. Next slide. So in the disease condition, the latency may be increased or maybe lack of recovery. That means it will be hung position, one of the slide I showed you. Next slide. Next slide. So this is how it looks in the normal and abnormal. Next slide. Next. So next slide. So it is mainly useful in autonomic neuropathy, peripheral neuropathy, and chronic idiopathic anhidrosis. We do get lot of patients increased sweating or no sweating at neurologically. We do this test. Next slide. Next, another test is sympathetic skin response. This is all the neurology lab they will have. So next slide. So here also afferent, efferent, centum, effector. Effector is the sweat gland. Next slide. So this is how you put it, the thing. Next slide. So with the latency, amplitude, duration, and the wave. This is also same. Next slide. Coming to role of Ayurveda in IFT. So till now I told you what are the autonomic nervous system, how it works. Now let me correlate with these two. Ayurveda is an ancient Indian system of medicine, focuses on balance within the body through the natural remedies and lifestyle. And next slide. Next slide. So I am going to talk about autonomic function in neuropsychiatric disorder. We all know that neuropsychiatric disorder often exhibits the disruption of the activity, and autonomic dysfunction occurs during the course, or maybe due to the disease itself, it can cause the autonomic dysfunction. And involving the autonomic function can help reduce the symptoms and decrease in the morbidity and the mortality by the autonomic dysfunction. Next slide. So how Ayurveda and autonomic nervous system is integrated? Next slide. So we all know that concept of Hridaya, Manas and Vata dosha. Hridaya and its significance. In Ayurveda, Hridaya is the heart. It is not only physical organ, it is considered seat for the Manas also. That's always where is. See, we don't know where is mind. Mind is in my brain or in the heart. Still it is a debatable. The integral connection underscore the influence of emotional, mental status and physical health and well-being. Here we should see role of Vata dosha also. Vata dosha relates neurological activity and governs various bodily function. It balances in the vital mental clarity, emotional stability, making the core principle in the treatment of neuropsychiatric disorder through Ayurveda therapy. Next slide. So you all know that maybe I'll skip functions of Vata dosha and what is the impact of dosha on mental and neurological disorders. Imbalance of Vata can lead to disturbance in the mental health. Characteristic various neuropsychiatric disorder, especially anxiety, depressions and the Parkinson disease or any other movement disorder. Next slide. So AFT is used as a measure of Vata dosha and implication of the treatment approaches. Incorporating the AFT findings in treatment of plan can enhance the effectiveness of Ayurveda intervention by providing tangible measurement to track the progress and the therapy outcome. These tests can help to bridge between the subjective assessment commonly used in Ayurveda to the objective. Say after taking the treatment, he say, yeah, I'm feeling better. Because patient don't want to displease the doctor because you have taken care so much. But if you do this, autonomic function is an objective so that the patient cannot lie and he can prove the scientific world there is a disturbance or it is there, whatever disturbance is there, it is modulated. Next slide. So Ayurveda therapy, I have few research work. We have proved that Ayurveda therapy influences the Ayurveda therapy like Panchakarma. They enhance the heart rate variability. More the heart rate variability is good for the life. That means the moment I sit to stand, my heart rate should change. When it is blunt, I am not healthy, I am not healthy, I am going to be diseased. So all this Ayurveda treatment helps to increase the heart rate variability. Next slide. So one of the study we published, that is evaluation of influence of Ayurvedic formulation Ayushman 15 in major depression. See, this is one of my PhD students' topic. We had a very tough time to convince ethics committee chairperson. What we wanted to do is, the ministry had given Ayushman 15 is it is a formulation they gave us. They gave the drug for us. And they want us to check whether it is helpful for the depression. So our ethics committee people, they said, no, this is a drug trial. We don't give, how can you start this drug naturally? Then we argued, we gave what are the ingredients, what are things. Sir, this is not a new thing we are doing. We are finding the new way how it cures the disease. So it was the first study in immense without it is what was not an add-on therapy. One group was given SSI, that is the serotonin part. Other group was given as TCI, tricyclic antidepressant. Another group, Ayurveda therapy. So we had a great challenge in doing that, and we proved the world. Directly people came and they took only Ayurveda treatment and they benefited. I'm going to show through the slides now. So we made into two groups, 81 drug now patients were diagnosed. So we had a psychiatrist said, no, this is the drug now, he has come to you. And how can you trial an experiment on giving them without giving the medical one? So as I told, Dr. Raju was a great help for us to support me and say that, okay, we'll give ethically approved. And we give group A and group B. So group A, group B, both are Ayurveda treatment, and group A has got Ayushman 15 along with Ashwagandha. We wanted to see whether Ashwagandha has got more influence or not. This is without Ashwagandha. So we measured by all the biochemical and the scorings, everything, and the results were significantly, next I'll go to the slides. Next slide please. Next slide. So as I mentioned, the objective was to reveal drishti in the patients with Vishada, employing the heart rate variability, comparing the age and gender healthy volunteers, and also we measured with the cortisol level also, not only with autonomic function. Next slide. Next slide. So it's a single blind prospective study with a pre-post design. Ethical clearance was given, and major depressive, depression patients were diagnosed by the psychiatrist and also Ayurveda physician. In this study, we published Vata rating scale, Vishada rating scale, and other 2 scales. Maybe in future, if you want, you can refer the scales and they can start your research on that. And next slide. Yeah, this is our next slide. This is exclusion criteria. Next slide. So the clinical assessment was done by the psychiatrist and also by the Ayurveda therapy. Vishada rating scale, Vata rating scale, it is published now. You can take that before any treatment, how much it was and what is the difference. And biochemical analysis for the plasma, cortisol and TCH, because these two are the hormone which influences the heart rate variability, other autonomic functions. Next slide. So this is the method. 104 students were recruited, 81 completed. We did the studies. Next slide. What we gave is Ayushman 15, 2 months were given with Shirodhara. Ayushman B also 2 months with Shirodhara. A has got more of Ashwagandha. And then next slide. So this is next slide. This is regarding that. Next slide. And so these are the drugs used in the Ayushman 15. Next slide. So how do we validate it? By Vata rating scale and Vishada rating scale. And next slide. HRV measurement. Next slide. And biochemical also I mentioned you. Next slide. And the 2 months of Ayurveda treatment significantly decreases the psychopathology, show the increase in the vagal tone, that is increase in the parasympathetic activity, decrease in the sympathetic tone with reduced cortisol. And the difference between A and B, both are decreased, but not much difference we found in with adding of Ashwagandha. Next slide. So in another treatment, modulation of cardiac autonomic function in the ischemic stroke following ischemic stroke. There are 2 types of stroke. One is the ischemic stroke and the other one is the hemorrhagic stroke. What do you mean? Because students are there, I am explaining. Ischemic stroke is in the brain, blood vessels will get blocked for whatever reason. So beyond that blood vessel, you have ischemia. That means no blood supply, the cell will die. That is called as a ischemic stroke. Whereas hemorrhagic stroke means due to increase in the blood pressure, whatever reason, the blood pressure will rupture. Beyond that place, again that blood vessel, rupture of the blood vessel, the brain cell will not get any nutrition thing. So that also it causes the stroke. In this we took ischemic stroke and we give one group as a physiotherapy, another group as an Ayurveda treatment. Ayurveda treatment with Abhyanga, with Mahabala Taila and all those things, Ashwagandha, everything, 14 days duration. Outcome, we saw the clinical development, HRV, blood pressure variability and baroreceptor sensitivity. Next slide. So here, hypothesis, stroke is neurological deficit. Clinical assessment was done, cortical excitability was done, and TNS, autonomic dysfunction. So coming to the Pakshagata, what we call it in the stroke in Indian medicine, allopathy medicine, pathology in the Shiras, main dosha involved is Vata, and the Lakshanas are done with a clinical assessment with cortical excitability and symptoms of Vata Dushti by the heart rate variability and the blood pressure variability. Next slide. So these are the slide which shows group 1, group 2. Next slide. Always we find group 2 was better. The group 1 had only physiotherapy, that is post ischemic stroke, whereas Ayurveda therapy had better improvement. Next slide. The conclusion is here, adjuvant therapy modulated autonomic activity in subacute ischemic stroke. So instead of giving physiotherapy, it's better to give Ayurveda therapy. We found more better compared to the physiotherapy. Next slide. So in another study, we did it in the cerebral ataxia. Here 2 groups were given, they were given 14 days panchakarma, 1 month oral therapy. So what we found is all patients tolerated treatment well without any adverse effect, and there is a significantly improvement overall anterior posterior balance indicating the dynamic stability. Next slide. In another study, this is the last slides, In another study, we used Manasa Mitra Vataka. Again, these drugs were given for us from the CCRS, and we did it here. So we diagnosed anxiety disorder. We made into the 3 groups. 2 groups were Ayurveda treatment, 1 group of the conventional treatment, and duration was 7 days, oral medication 1 day, oral medication 1 month. So all the groups showed significant reduction in the clinical matter, but the group B, that is Manasamitra Vataka with Shirodhara, with Brahmi Taila, there was a much better results with this. So Shirodhara helps in anxiety disorder. So next slide. So integrating Ayurveda research, next slide, AFT research. So the main objective, the measurement efficacy is integration of AFT in Ayurveda research provides quantitable. See, I told you, you can quantify before therapy how much it was there, after therapy it is an objective, it is not a subjective. And enhancing acceptancy, because scientific validation is essential for promoting acceptance of Ayurveda methods within the border of biomedical community, encouraging further research collaboration between the 2 disciplines. Then only, now of course we say that the alternative medicine is yoga and Ayurveda. Next, allopathy should become alternative treatment. So when that can happen, more research, and we should prove the world. Next slide. Next slide. So this is the opportunity investigate. Time is over. I'll finish it fast. Next slide. Next. Conclusion. Next. So the final thought is application of cardiac autonomic function test in Ayurveda research represents a significant step towards the integrative medicine. By providing objective measurements of autonomic regulation, AFT can validate the efficacy of traditional Ayurvedic practices, enhance their acceptance to the scientific community. That is more important. Next. This interdisciplinary approach, see, AFT is allopathy, Ayurveda. So not only enriches our understanding of Ayurveda, but also paves the way of more personalized, effective healthcare solution. As the fields of Ayurveda, modern medicine continue to evolve, integration of diagnostic tools like AFT can play a crucial role in advancing holistic health and well-being. Next slide. Next slide. So I learned Ayurveda through these my gurus. That means they are all my students. Kishore was my first Ayurveda student in 2005 to 8. Now he is a professor heading the integrative department. So before he joined me, I didn't know much about Ayurveda. Along with him, I learned. So I call them not my student, their guru. And Sri Ranjini, she is in Canada, very well practicing Ayurveda there. And Basvaraj Tubaki is my student. Right now he is in Belgaum, he is a professor and head of, I think, Kaya Chikitsa. And Dr. Umesh, he is doing his PhD now and currently he is at Nimmans. I always, with humble thanks, I presented this talk because of them. Next slide. I end my talk with this. Patience with family is love. Patience with others is respect. Patient itself, you should have patience with you. Then that is the confidence, and patience with God is the faith. Don't fail. If you don't get the good marks, don't fail. Have a confidence, have patience. In the next exam, you get a better marks. Thank you. Namaste. Sorry, I took long time than given. Sorry. Any questions?
Thank you, ma'am. Now the session is open for questions and answers. Also, the delegates may drop their questions in the drop box kept near the stage for the panel discussion.
I would like to request our chairperson, Dr. Ramesh KL sir, to give a valuable remark for this session.
So namaste to all, very good afternoon. So at the outset I would like to express my sincere thanks to respected B.R. Ramakrishna sir for having invited me to this institute. I also happen to be a former employee of Sushrutha Ayurveda College 5 years before, 6 years before, I think in 2017. And also would like to express my sincere thanks to Professor Alok Rai sir, who is also my good friend. And we are department mates for having me here with you. And also one important thing, I would like to express my sincere thanks, and because I think I'm very inexperienced and very short of experience to share a dais with such legendary none other than our respected Prasanna, and also as well as the esteemed speaker of today's event. But still I consider this as an opportunity to experience the discussion of the discourse of knowledge with all of you, sir. Thank you very much. I have given 5 minutes time. Before that I would just like to tell, I represent the Department of Translational Research in All India Institute of Ayurveda, New Delhi. So for most of the students, those who are sitting here, probably it may be a new thing to you what translational research is. Translational research is a very established department in the modern medicine. In the most of the medical universities, this department is there. But for Ayurveda, for the very first time, Ministry of Ayush has introduced this department in All India Institute of Ayurveda, New Delhi. So this department mainly works on the, like as Madam emphasized, the importance of integration and integrative systems of medicine, and translational system research. It is mainly the interdisciplinary collaboration where many scientists coming together and to address the real-time issue based on the ground report. So in continuing with the Madam's address, just I would like to begin with one statement that we all know, that the first statement of Ashtanga Hridaya, Ragadi Roga Sahaja Samula. So Ragadi Roga is the very beginning concept of Ayurveda, because we all very much, because Nimans and neurophysiology is one area where Ayurveda has a real potential to explore. Because when we look into the causes for birth in the Ashtanga Hridaya Nidhanasthana, first chapter itself, he makes clear, apart from having Shuddhe Shukrarthavas Tejaha Swakarma Klesha Choditaha, he says that it means the concept of having birth itself, it is well defined in a very holistic manner. So because the Ragadi are the Adi diseases, which again represents the diseases of mind in Ayurveda. So if we ask which is the first disease to manifest, diseases of mind or diseases of body, it is the diseases of mind is the one which is to manifest for the first, and that is where we have the real potential to explore all these available technologies related to Ayurveda. Okay, so emphasizing the keynote speakers address, so I would like to tell one more statement, like we have in Charaka Samhita Sutasthana, Samagra Dukkham Ayatam Avignane Dvayashrayam. Samagra Dukkham Ayatam Avignane Dvayashrayam. And Sukha is the result of Vignane Vimalecha Pratishtitam. He says that. It means for the root cause for all the sufferings, it is Avignana. Charaka very clearly says that Avignana is the root cause for all the sufferings, and for entire Sukha, the cause is the Vijnana. So the Vijnana and Avignana is very popular. In Charaka Samhita, if you see that, there are as many as more than 45 descriptions where the word Vijnana is mentioned. So in different places, the Vijnana is interpreted in different way. If you see the very first chapter, the remedial measures for the psychiatric diseases in Ayurveda, Madam, it is said that Jnana Vijnana Dhairya Smriti Samadhivihi is the very important treatment protocol for psychiatric diseases in Ayurveda. So Vijnana, in that context, Charaka says that it is Shastra Jnana. And if you go to the 9th chapter, Kuddaka Chatushpadi, he says that Shastrantara Jnana. Again in the 29th chapter, Artha Dashamahamulya Adhyaya, he says that Vijnana is actual, that is Buddhi, that is the clearest form of the cognitive functions. And also Vijnana is said as Buddhi in Siddhisthana in Palamatra Siddhi. So Vijnana is Shastra Artha Jnana. It is the clear state of mind which we can execute the thing in an appropriate way. So, for Ayurveda students or graduates or the professionals, the most important thing is we need to understand Ayurveda in its original fundamental character. That is very, very important. So when we have understood Ayurveda in its original character, then only it is possible for us to translate Ayurveda into the applicabilities with these sort of advanced technological gadgets. So that is very, very essential, because Vijnana makes a person who is very, very skilled. Again, Charaka says that who is skilled, Kushalascha, he says that Smriti, Mati, Shastra, Yukti, Gnanasya Atmanaha. He is said to be the Kushala. It means the one who has the ability to observe and examine the things well, he is actually defined as Kushala. So Kushala is the skill. And the background for this skill to manifest is the ability for us to process through the Yukti Pramana. That is why Ayurveda emphasized Yukti as one of the greatest form of the ability to shine in our professional practice. That's why Charaka says that Tishtat Upayuktignaha Tevijnanavatam Sadaha. So, Madam, coming to your discussion, Madam, as you have given some examples of how this particular autonomic function tests can be employed in various Ayurveda clinical conditions. In addition to that, Madam, we have, as a person from translational research, we have the major challenge for us to evaluate the constructs, Madam. So, we have a lot many construct and psychometric scales. So, while evaluating any construct, the psychometric scale, still if we give to 10 people, we have the, the discrepancies of the opinion by all the 10 people. So, we haven't yet able to achieve any uniformity. So, the most important thing, say for example, Charaka says that Trividam Jnana Samudayana, to understand anything, we have to apply Aptopadesha, Pratyaksha, Yukti, all the three things. So, without Aptopadesha, Pratyaksha and Anuman, all the three are very crucial to understand anything. At the same time, for most of the psychometric analysis, the important pramana which is advocated is Anumana pramana. So he says that how to measure Krodam Abhidrohena. We know that Abhidroha means Parapida Pravritti. So how to evaluate Kroda in any person. At the same time, how to assess Pritim Toshena. At the same time, how to assess depression. Say, for example, you mentioned Vishada. So, Bhayam, Vishadena. How do we assess Bhaya? It is fear factor, it is Vishadena. And Dhairya, how do we assess? It is Avishadena. It is just opposite to Bhaya. And in the first chapter sutra, he said, what is Dhairya? Chakrapani says that it is Anunnata Chetasaha. It means normally we attribute Dhairya to Pitta Prakriti, but actually it is not Pitta Prakriti. Dhairya is actually very much composed state of mind, that your mind does not react to anything in a very stable, it maintains the stability of the mind. That is actually Dhairya. In fact, Dhairya is the characteristic feature of Kapha Prakriti, because Kapha is having the Kshama. So, in this way, madam, these scales, autonomic function tests are very, very crucial to understand all these constructs or the variables which we are unable to only understand through the psychometric scales. And as madam rightly pointed out, that all these scales provide a quantifiable data, because quantifiable data is very, very essential, because for the true diagnosis or the truly positive diagnosis, because we are not so far able to achieve the true positive. So in all possible dimension, you figure out this is the particular diagnosis and there is no other possibilities. That is what we need, more sensitivity and specificity. And all these things can be certainly achieved with these sort of technological helps or the gadgets. So in this way, this autonomic function test, as madam said, it has so much the potential, a plethora of opportunity is definitely possible for Ayurveda research. Particularly, madam mentioned about the Hridaya. So we all know that Hridaya is not only an anatomical structure, as madam mentioned rightly, it is also a seat of Chetana, seat of soul, what we understand, because Hri, Rishaya Riti, it means Hridaya receives all the impulses. That is, all the jnana is being pursued by you, and it directly goes to your heart. And from the heart, immediate the response is expressed in various. So the heart rate response variations can be observed in all these conditions like Bhaya, Krodha, Chinta, Shoka, because Shokam, Dhainya, we say that Dhainya is Rodhana. So how do we measure how this internal visceral organ respond to all these different psychological conditions? We can measure with quantifiable data with these types of information. At the same time, one last interesting information I would like to tell that in Kiyanta Shirishi Adhyaya of Sutrasthana, we have Trimarma. So if you just observe, madam, that is another one area where this ANF can be employed very well. The first Nidana to mention for Shiroraga is Vega Sandharana. So there is not much thing has been explored to understand the Adharaniya Vegas. There are non-suppressible urges are there in the body, madam. That is nothing but the entire visceral organ functions, starting from appetite to coughing, breathing, yawning. All these things represent the Adharaniya Vegas. So to measure quantifiably, because we do not clinically evaluate or we do not put any effort to screen the involvement of all these Adharaniya Vegas or suppression of these urges in our clinical diagnosis. But with the help of these tests, definitely it is possible to understand is there any real pathology is concerned with these internal visceral organs. That is one area. And apart from that also, if you just see that there are many reasons for their kshaya. But among the many reasons, there are three important reasons are the chinta, bhaya, shoka, are the universal causes for all types of kshaya. So how do we measure? We have the psychometric measurement through Anumana Pramana, but we don't have any quantifiable mechanism to measure. So this is very, very new to Ayurveda. It has to be explored and it has a very good potential to come out with a real translational research is very much possible with incorporating these sort of technological innovations, madam. And I take this forward because I would like to establish this autonomic function test unit in our All India Institute of Ayurveda also, because it has much wider practical applicability also. So there is so much is there to discuss about this. This is very interesting. And as madam said, her Hridaya is not only sthana for Chetana, it is also sthana for Ojas. And indirectly we can also try to understand the Ojas in case of Ojakshaya Avastha, because you have Dushchayo, Durmana. So all these Lakshanas are there. How in Ojakshaya Avastha, what could be the internal organ function responses. So all these sort of things can be definitely explored with these kind of things. So I think they gave me 5 minutes, I took more than 5 minutes. So if time is there, we could have discussed, but still it's a wonderful, it has a great window of opportunity, and certainly for the scholars it is very essential to understand, and you can implement these in your future research works. And thank you very much, madam. Before I conclude, just I take 1 minute, that is Gnanothana. That is Gnanothana Upakarana Sampatsu Nityam Yatnavatocha. That is a statement of Charaka. He says that you should always engage in yourself in the discourse of knowledge. So that is why, that is how we elevate our wisdom to the next level. At the same time, all these gathering, nothing but the Tadvidya Sambhasha, Bishajam Saha Sambhashita Tadvidya Sambhasha, Tadvidya Sambhashohi Gnanabhiyoga Samharchakaro Bhavati. It is certainly the discussion, the intellectual discourse certainly produces a kind of happiness or satisfaction. And he says that Vaisharadyam Abhinivartayati, Charaka says that. So you can really enhance your scholarliness by participating in all these kind of activities. So finally I would like to express, I think I spoke a little fast because I need to cover my things. So I thank all the organizers, particularly again B.R. Ramakrishna sir and Alok sir and all his team for having me here. And also I would like to express my sincere gratitude to have shared the dais with the legendary and the inspiration to all of us that sir, what the mark you have left, we all try to walk in that path what you have created, sir. So thank you very much. I personally take this opportunity and also to thank madam, and thank you one and all. Namaste.
Thank you, sir, for the in-depth remarks. I now request Dr. Prasanna and Rao sir to give his valuable remarks.
Namaskara. We have listened to Dr. Sathyaprabha, and it's really motivating all of us, both for understanding the Ayurveda concepts through modern line of thinking, and also it helps rather increase our confidence in practicing Ayurveda. Ayurveda I always feel that there is no allopathy. There is no allopathy. That's why the allopathy term has been removed and it is considered as modern medicine. Allo means different, others. And everything, the knowledge which helps us to lead a better life is Ayurveda. And I still remember Nimans and the professors of the Nimans always involved in most of Ayurveda concepts. When I joined my professional, the assistant lecturer in way back 90s, and Nimans conducted one of the conference. There is a bridging between Ayurveda and Western medicine, especially one of the dental national, dental organization institute, right? It collaborated with Nimans, a dental organization of US. At that time, many times I visited Nimans, that's long back. And I am just closely watching, and Kishore is our product from our SDM, and I am closely associated with him, and I am always happy to know the developments. And today we could have the informations regarding all the research what the Nimans has conducted under the guidance of Dr. Sathyaprabha. It's really motivating all of us. We know, we find difficult in understanding the concept, but we know, right? Vyano Vridistitaha, Sadhaka also in Hridaya, and Avalambaka Kapha is also in Hridaya. Same way, it has a control on the different kind of Vata, Pitta, Kapha has influence on different diseases, organs. And understanding in the modern parameter is also very important, right, to convince our clients, health clients. Dear friends, these days, lot of research is happening on Ayurveda knowledge. I was listening to Dr. B.M. Hegde, is a cardiologist. We invited him for some program, and we found him that he was praying God in two different postures. And we were surprised, what is this? Ondsala Padmasanadalli haki prayer ಮಾಡ್ತಾರೆ, ಇನ್ನೊಂದ್ಸಲ ಹೇಗೆ ವೆಸ್ಟರ್ನರ್ಸ್ ಚರ್ಚಲ್ಲಿ ಪ್ರೇ ಮಾಡ್ತಾರೆ, kneeling the knee. ಸೊ ಅದನ್ನು ಆ ರೀತಿಯಲ್ಲಿ ಮಾಡಿದ್ರು. Then I asked, what is this ಎರಡೆರಡು ವೇಷ? Then he said, what I did in Padmasana, the prayer in Padmasana is for my peace, my health. And what I did in the other posture is for the patients who are admitted in a Royal School of Surgeons and people, Glasgow. And people, ಅಲ್ಲಿ ಏನು ಮಾಡಿದ್ರು ಅಂದರೆ 2 groups ಮಾಡಿದ್ರಂತೆ. ಒಂದು ಗ್ರೂಪಿಗೆ the people who are posted, decided, right, these people are supposed to undergo the cardiac surgery, and ಅವರಲ್ಲಿ AB ಗ್ರೂಪ್ 2 ಮಾಡಿದರು. ಒಂದು ಗ್ರೂಪಿಗೆ ಒಂದು ಹಾಲಲ್ಲಿ ಕೂರಿಸಿದ್ರು, ಅವರಿಗೆ ಇಷ್ಟು ನಿಮಿಷ ಆ್ಯಸ್ ಪರ್ ಪ್ರೋಟೋಕಾಲ್ ಅವರಿಗೆ ಪ್ರೇಯರ್ ಮಾಡಿಸಿದ್ರು. ಇನ್ನೊಂದು ಗ್ರೂಪಿಗೆ ಪ್ರೇಯರ್ ಇಲ್ಲ, ಅವ್ರು ಸುಮ್ಮನೆ ಟಿ ವಿ ನೋಡ್ತಾ ಕೂತ್ಕೊಳ್ಬೇಕು. And it was found that the group which was undergone the prayer, and more than 80% of the patient, right, didn't require the surgery. So ನಮ್ಮ ಸ್ಟ್ರೆಂತ್ನ ಮೇಲೆ ನಮ್ಗೆ ಅರ್ಥ ಆಗಬೇಕು, ಆ ಎವಿಡೆನ್ಸ್ಗಳು will increase the understandings. So ಇವತ್ತು ನಾವು that's what we have realized by what madam presented, very good publications through the Nimas under her guidance. One more what I understood is thermotherapy. Madam temperature ಬಗ್ಗೆ ಹೇಳುವಾಗ ನನಗೆ ಭಾಳ ಇಮಿಡಿಯೇಟ್ ತಲೆಗೆ ಬಂದದ್ದು ಅದು ಸಂಜಯ್ ಗಾಂಧಿ ಪಿ ಜೆ ಚಂಡೀಗಢ ಇದರಲ್ಲಿದೆ ಲಕ್ನೋದಲ್ಲಿ ಸಂಜಯ್ ಗಾಂಧಿ ಕ್ಯಾನ್ಸರ್ ಇನ್ಸ್ಟಿಟ್ಯೂಟ್. ಆ ಸಂಜಯ್ ಗಾಂಧಿ ಕ್ಯಾನ್ಸರ್ ಇನ್ಸ್ಟಿಟ್ಯೂಟಲ್ಲಿ ನಾವು ಏನು ಆಯುರ್ವೇದದವರು ಅಗ್ನಿಕರ್ಮ ಮಾಡ್ತೀವಿ, ಅದಕ್ಕೆ ಹೆಸರು ಅಗ್ನಿಕರ್ಮ ಅಂತ ನಾವು ಮಾಡ್ತೀವಿ. ಅದನ್ನೇ ನಾವು ಮಾಡೋದನ್ನು ನೋಡಿ ಪುಸ್ತಕದಲ್ಲಿ ಓದಿ ಈಗ ದಟ್ ಹ್ಯಾಸ್ ಏನು ಸಂಜಯ್ ಗಾಂಧಿ ಕ್ಯಾನ್ಸರ್ ಇನ್ಸ್ಟಿಟ್ಯೂಟಲ್ಲಿ ಅದನ್ನು ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡ್ತಾರೆ. ಅವ್ರು ಏನಕ್ಕೆ ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡ್ತಾರೆ ಅಂದರೆ ದೇ ರೈಸ್ ದ ಟೆಂಪರೇಚರ್. ಮೇಡಮ್ ಅಲ್ಲಿ ಹೇಳ್ತಿದ್ರು ಟೆಂಪರೇಚರ್ ರೈಸಿಂಗು. ಸೊ ಯಾವುದು ರೆಗ್ಯುಲೇಷನ್ ಮಾಡ್ತಾರೆ ಹೈಪೋಥಾಲಮಸ್. ಸೊ ಟೆಂಪರೇಚರ್ ರೈಸ್ ಮಾಡ್ತಾರೆ ಎಲ್ಲಿ ಡಿಸೈರ್ಡ್ ಪಾರ್ಟಲ್ಲಿ. ಸಪೋಸ್ ದ ಕ್ಯಾನ್ಸರ್ ಈಸ್ ಇನ್ ಒನ್ ಪರ್ಟಿಕ್ಯುಲರ್ ಏರಿಯಾ, ಸೊ ಆ ಏರಿಯಾದ ಟೆಂಪರೇಚರ್ನು ರೈಸ್ ಮಾಡ್ತಾರೆ. ದಟ್ಸ್ ಕಾಲ್ಡ್ thermotherapy. Once they rise the temperature, then they inject chemotherapy in cancer patients. Outcome ಏನಂದರೆ the sensitivity of the cells will increase when you increase the temperature towards ಏನು ನಿಮ್ಮ chemotherapy drugs sensitivity ಜಾಸ್ತಿ ಆಗುತ್ತೆ. ಸೊ ದಿಸ್ ಈಸ್ ದಿ ಔಟ್ಕಮ್. ಸೊ ಯಾವಾಗಲೂ ನಾವು ಅವರು ಬೇರೆ ಇವರು ಬೇರೆ ಅಲೋಪತಿ ಅಂತ ಹೇಳಿದ್ರೆ ಅದು ತಪ್ಪಾಗತ್ತೆ. ನಾವು ಯಾವಾಗಲೂ ಮೇಡಮ್ ಭಾರಿ ಒಳ್ಳೆ ವರ್ಡ್ ಹೇಳಿದ್ರು, ಏನು ಆಲ್ಟರ್ನೇಟಿವ್ಗಿಂತ ಸಹ ಬೆಟರ್ ವರ್ಡ್ ಅಂದರೆ ಕಾಂಪ್ಲಿಮೆಂಟ್. ಸೊ ವಿ ಶುಡ್ ಬಿ ಆಲ್ವೇಸ್ ಕಾಂಪ್ಲಿಮೆಂಟ್ರಿ, ವಿ ಶುಡ್ ಗೋ ಟುಗೆದರ್. ದಟ್ಸ್ ವಾಟ್ ಮೇಡಮ್ ಹ್ಯಾಸ್ ಗಿವನ್ ಎ ಮೆಸೇಜ್ ಟು ಆಲ್ ಆಫ್ ಅಸ್. ನಮ್ಮಲ್ಲಿ ಧಾತು ಸಾಮ್ಯ ಕ್ರಿಯಾ ಪ್ರೋಕ್ತ ತಂತ್ರಸ್ಯ ಅಸ್ಯ ಪ್ರಯೋಜನಂ ಅಂತ ಹೇಳ್ತಾರೆ. ನಮ್ಮದು ಕ್ರಿಯಾ, ನಾವು ಕನ್ನಡ ಸಂಸ್ಕೃತದಲ್ಲಿ ಕ್ರಿಯಾ ಹೇಳಿದ್ರೆ ಅವರು ಫಿಸಿಯಾಲಜಿ, ಅದು ನಿಮಾನ್ಸ್ನಲ್ಲಿದ್ದ ಕಾರಣ ನ್ಯೂರೋಫಿಸಿಯಾಲಜಿ. ಸೊ ಎಲ್ಲರದ್ದು ಕೆಲಸ ಒಂದೇ, ಏನಂದರೆ ಧಾತು ಸಾಮ್ಯ ಮಾಡುವಂಥದ್ದು. ಸೊ ಲೆಟ್ ಅಸ್ ಗೋ ಟುಗೆದರ್. ಐ ಸ್ಪೆಷಲಿ ಥ್ಯಾಂಕ್ ಎಸ್ ವ್ಯಾಸ ಯೂನಿವರ್ಸಿಟಿ ಆ್ಯಂಡ್ ಸುಶ್ರುತ ಆಯುರ್ವೇದಿಕ್ ಕಾಲೇಜ್ ಫಾರ್ organizing such a novel program, and that too bringing together Ayurveda and modern science. It gives a great message for upcoming doctors, and I hope you have taken a good message from this presentation and implement in your practice. On behalf of the organizer, not as a chair, as on behalf of the organizer, we thank you, madam, for presenting such a wonderful, knowledge-based and evidence-based thing. Thank you, ma'am.
Thank you, sir, for sharing your valuable insights. Now it is time to felicitate and honor our speaker. I request Dr. Shailaja ma'am, Dr. Alok Roy sir and Dr. Sangamitra ma'am to come on to the dais and felicitate our speaker. And the chairs also, Prasanna Rao sir and Ramesh sir. request our dignitaries to felicitate our chairperson, Dr. Ramesh Kumar KL sir.
We have one of the most celebrated personality of Ayurveda fraternity, Dr. Prasanna N. Rao sir. We are truly honored for accepting our invitation and making time in your busy schedule, sir, and being with us and chairing this session. Thank you so much, sir.
I request all the dignitaries of the dais to please come on to the stage for the felicitation. I request Dr. Madhav Divigavi sir and Dr. Veeraya Hiramat sir to come on to the dais and join the felicitation.
Again, Dr. Ramesh Kumar, he is an alumni, I should say, with regard to our faculties. And his growth is so fast. He was here, later he went to CCRAS, and then now All India Institute of Ayurveda, the most prestigious institution in this country. And his field of research is excellent. And I was just listening to his comments where he was quoting references of more than 20. So it shows in one, the depth of knowledge he possesses. I wish him, I bless him, many more things in future. Okay?
Thank you all the dignitaries. Vidya prashasyate lokaihi vidya sarvatra gaurava vidyaya labate sarvam vidwan sarvatra pujate. With this note, we would like to conclude this morning session. Tea is arranged for all the staff and dignitaries on the left side of the hall and for all the delegates on the right side of the hall. Will be there. After that, the second session will continue. Thank you.